and Natalie. You will hear from them shortly. Heidi's been in this fight for some time now. Natalie, thank you for making the sacrifice to travel here and share your invaluable perspective. Most importantly today, I want to recognize the cutest participants, all the babies in the room.
I want to snuggle them.
I know, thank you. We're there. We're all good at that.
That's right.
Awesome. So thank you especially. And we've got another really cute tiny one back here, so just there.
I've got my eye on that one.
Okay. In the end, actually, this is about them. It's about their health and their future, and that's why we're here. We're here because, once again, President Trump and Republicans have decided to pander to their extreme base on health care. Once again, women's health is being used as a political football, and moms and families are being put at risk. And once again, women are left to wonder and worry about what will happen to their health care and to their families' health care. You know, we've heard a lot of promises from President Trump and Republicans about what Trumpcare would do for patients and families. But the reality is, when you look at the fine print of this bill, which it sounds like apparently very few House Republicans did, Trumpcare is not about helping people get covered or making care more affordable or any of the other promises we've heard. Instead, it is a bill about notching a political win by repealing the Affordable Care Act. All they care about is the promise. And it is a bill especially about providing a massive tax break to the special interests and the very wealthy while raising health care costs for everyone else and ripping away coverage for 24 million people. I have to say, in all of my time in Congress, I have never seen such a damaging, backward-looking bill for working families. But all of this, predictably, I must say, is especially true for women and children. For one, Trumpcare would practically make being a woman a pre-existing condition. In fact, a routine pregnancy could be classified as a pre-existing condition under Trumpcare. And Trumpcare would allow states to gut essential health benefits like maternity care and newborn care and all the other care our families depend on, like prescription drugs and mental health services. And of course, the dangerous proposal ends Medicaid as we know it, which pays for nearly half the births in our country. And it would leave families like Natalie's worrying about whether they will be able to afford the care they need. I feel strongly there is no good reason that a parent should have to worry here in our country about whether or not they can pay for potentially life-saving care for their children. We can and we must do better. But just about every way you look at it, Trumpcare would make health care dramatically more expensive for our families who are already struggling. So that's why today, just ahead of Mother's Day, Senate Democrats have a very clear message for President Trump and Republicans, and perhaps especially for the 13 male senators who are in some room writing this. We are going to stand with mothers and children and families every single day against this appalling legislation. Senate Republicans should set aside their politically motivated efforts to rip apart our healthcare system in ways that force women and families to pay more, and instead work with Democrats to continue fixing the challenges in our healthcare system. I really hope they listen, because as they can see clearly here today, women are paying close attention, and they are prepared to hold Republicans accountable for their actions if they choose to stay on this partisan, harmful route. And the Senate Democratic women will be standing right there along with them. So with that, I'm very proud today to have Natalie Weaver here. She is a mom from North Carolina and has a very important story to share, and with Heidi Murkoff, who has written an amazing book, What to Expect When You Are Expecting. It is the Bible for all expecting moms. So thank you so much for being here as well. With that, Natalie, we'll let you go first.
All right. Thank you all for having me here today. My name is Natalie Weaver. When my husband and I decided to start a family 9 years ago, we were excited about our future and never even considered the possibility that our child would be born with numerous complications, also known as pre-existing conditions. Ever since Sophia's birth, we've learned to be her voice and her advocate. Sophia requires constant care. Her condition has robbed her of the ability to walk, talk, and do anything for herself. She's had countless hospitalizations, 21 surgeries, daily therapies, and frequent doctor's visits. She suffers from daily seizures, tremors, type 1 diabetes, and an immune deficiency, just to name a few. At just 8 years old, she is the strongest human being I know and has the sweetest spirit I have ever seen. My husband has a great job, works full-time, and our family has private insurance. Despite that, it doesn't cover our daughter's in-home nursing, life-saving medical equipment, or portions of her life-saving medications. Thankfully, my daughter receives secondary insurance through Medicaid's home and community-based services. This amazing program helps cover the many costs that private insurance won't and allows us to have a hospital-style setup in Sophia's bedroom so that she can remain safe and cared for in our home. Not only would the AHCA put this program at risk by reducing funding for Medicaid, it may also allow states to get rid of the protections for those with pre-existing conditions that families like mine rely on to be able to afford insurance. Lifetime maximums and caps could come back, and for some medically fragile children, they could hit their maximum limits within the first year of their life. What happens to these children and their families when they lose health insurance? Simply put, these changes are the difference between life and death for our medically fragile children. Families would be forced to make the awful decision to institutionalize their children just to keep them alive. Not only is institutionalization devastating for children and families, it also costs more than home and community-based care. Many families with medically fragile children are faced with unimaginable challenges. They do not have the means to speak out, which is why I, along with 2 other warrior moms, have co-founded Advocates for Medically Fragile Kids NC. We are fighting for all families and their medically fragile children too. I have fought for Sophia's life since the day she was born. I know that one day I will lose her to one of her conditions. My heart will be absolutely shattered when that day comes. But if I lose my sweet Sophia because our government decided her life wasn't important enough to protect, well, that will destroy me. It is a senseless tragedy no parent or innocent child should ever have to face. Thank you.
Thank you so much. Thank you.
Thank you.
Well, I think that pretty much says it all. Healthy futures start with healthy beginnings, and that starts with quality preconception, prenatal, delivery, postpartum, and newborn care for every mom and every baby. It starts with a healthy woman being able to plan a healthy pregnancy thanks to comprehensive contraception coverage under the ACA currently, and receive the care she needs during that timely pregnancy to nurture and safely deliver a healthy baby. Of course, every mom's greatest gift on Mother's Day and every day. Did you know, and trust me, few did before the House passed this bill that could instate this unthinkable practice, that before ACA, pregnancy was considered a pre-existing condition, that reliable birth control wasn't reliably affordable, resulting in more unplanned and thus riskier pregnancies, that pregnancy and postpartum depression and mood disorders, which impact upwards of 20% of expecting and new moms, often went undiagnosed and untreated, largely because they weren't covered by insurance. For me, as a mom and as a grandmother, it's unconscionable to think of maternity care as anything but an essential health benefit, probably the most essential of health benefits. To think of a mom going,
That's right.
there you go. Seriously. Oh, no, it's not going to happen. We're going to stop it. We're going to stop it. Don't worry. To think of a mom going without regular prenatal care simply because she can't afford it, as many used to and still sometimes do. Not seeking care until it's too late, often until the last trimester. Using the ER as a last resort instead of visiting a doctor or midwife for vital monthly prenatal checkups, waiting until small problems become serious complications and take a tragic toll. But that's exactly what the AHCA might do. Under this reprehensible bill, states could opt out of requiring maternity care as an essential health benefit, essentially imposing a pregnancy tax, a healthy baby surcharge, if you will, of an estimated $17,000. Women just thinking about the possibility of becoming pregnant, they would have to disclose their possible baby-making aspirations on their insurance forms and would be forced to pay more if pregnancy were in their plans, literally. Medicaid, which currently pays for about 50% of births in the U.S., will be slashed under the bill, potentially depriving hundreds of thousands of moms of prenatal care, safe deliveries, and newborn care they and their little ones deserve. Lifetime caps could be put on employer-based coverage, resulting in astronomical costs for families who experience a complicated birth or a baby with birth-related disabilities or any disabilities. Had a C-section, been a victim of rape, you'd pay for that too. So maybe you're not feeling all that compassionate. Maybe you're more concerned about the healthcare bottom line. Okay, fair enough. But there's a reality check. Planned, healthy, uncomplicated pregnancies, or those in which complications are caught and treated early, don't come cheap. I will grant you that. But as the ultimate in preventive care, preventing a lifetime of costly care from the NICU to long-term disability, from type 2 diabetes to future hypertension and heart disease, it is the ultimate in cost effectiveness too. For the fiscally fearful, I just ask that you please do the math. You will save millions now and billions later by providing basic care for expecting moms. Besides, I think we can all agree the cost of a healthy mom and a healthy baby, priceless. You know, I always say that motherhood is the ultimate sisterhood. We are our sister's keeper, and we share a collective responsibility for her health and well-being and the health and well-being of her baby. All of our children are our responsibility. That's not a partisan issue. There are no red moms or blue moms. There are no red babies or blue babies. No red bumps or blue bumps. That's a fundamental human issue. And comprehensive, quality, affordable preconception, prenatal, postpartum, maternal mental health, and newborn care for every mom and every baby is a fundamental human right. As members of the same human family, not as members of political teams in a political game, it's up to us to fulfill that right without exception. And by the way, a commitment to life, in my book, should be a lifetime commitment. This Mother's Day and every day, let's put moms and babies first, where they belong. Join us in raising our mom and dad voices to speak up for every mom and every baby and ensure them the care that they deserve. Let's work to protect their care. Let's reject the AHCA and improve the ACA. Let's work together, united, to cover more moms and more babies, not fewer. And let's do it as if our future depends on it, because actually it does. Thank you, and happy Mother's Day, everyone, to all my mom senators and all moms everywhere, and all who love them.
Yeah, that's right.
Thank you, guys. Thank you for fighting the good fight.
Thank you. Thank you.
Oops.
Thank you, Heidi and Natalie, for sharing your stories. And you know, Trumpcare will impose multi-generational pain, all the way from prenatal through seniors. And of course, there's a lot of focus today as we approach Mother's Day on the need to protect our babies and mothers. But I want to talk a little bit about the pain that will be caused to our grandmothers and for example, my mother, who's 92 years old. I've lived in a multi-generational family for much of my life. And my mother's 92. She's lived with me and my husband for over 20 years. My grandmother lived with us till she was 98. But Trumpcare is going to cut Medicaid to the tune of over $800 billion. That is more than what the bailout of the banks represented during the height of the economic crisis. Over $800 billion that will go straight into the pockets of the richest people in our country. So the way I look at Trumpcare, it really is a huge tax break for the richest people in our country, masquerading as some kind of a health care bill that is supposed to take care of all of us, which is nothing could be further from the truth. So my grandmother, who lived with us until she was 98, in the last year of her life, she needed better care or better care than we could give her. So she had no assets. She was in a long-term care facility for the last year of her life. Most long-term care facilities have residents who rely on Medicaid. What are all these people supposed to do if Trumpcare goes through? I had 2 town hall meetings. You know, one of the great things about the town hall meetings that we've been watching all across the country is that people who are being helped by the Affordable Care Act actually come now and they go to all these town hall meetings, not just shouting slogans, but with actual real-life concerns and experiences that Trumpcare will impose upon them and their health care needs. So that's great. I had a couple of town hall meetings this past weekend, and hundreds of people came, and most of them were very concerned about what Trumpcare would do to them. I mean, literally, to them. I also heard from hundreds and hundreds of people who contacted my office, and just let me tell you, Heather from Honolulu, she was self-employed before the Affordable Care Act was passed. She paid $300 a month for catastrophic insurance for her and her son. That's all she could afford. She couldn't afford the regular underlying basic policy, but she just had catastrophic insurance. She wanted to have a second child and paid for an additional pregnancy rider, and this rider should have covered the cost of a routine pregnancy. However, Heather's daughter was born 2 months premature and had to stay in the hospital for over a month. Heather's insurance wouldn't cover the additional costs, and she had to pay nearly $400,000 out of pocket for her and her daughter's care. And she wrote to me, quote, "Needless to say, this wouldn't have happened under the Affordable Care Act and could very easily happen again under Trumpcare." So you've heard the stories from Heidi and Natalie and my colleagues who have been such strong fighters to make sure that healthcare is a right, not a privilege. And so there are many, many Heathers out there. There are many people whose grandparents are in long-term care facilities who rely upon Medicaid, and it is unconscionable that Trumpcare is a huge, huge tax shift from the people who need the health care to the richest people in our country. I thank my colleagues for letting me speak first because I will not be able to stay for the full press conference. Mahalo nui loa, everyone.
Thank you so much. We're going to take the top sheet that you took there. We're going to take
Ooh,
back. So,
there we go.
yes, thank you, thank you, thank you, Senator Hirono and Senator Murray, all my colleagues, and Natalie and Heidi. First, I want to say that Happy Mother's Day, as has been said, to all the moms and grandmas and aunts and the women who are role models and caregivers for all of our children. Standing here today, I stand here for my mom, who is almost 91, who was a nurse for 42 years, worked in the emergency room long before the health reforms we have now, and she went on to be director of nursing at a hospital. But she talked to me a lot about the fact that so many people in our community growing up that couldn't see a doctor would use the emergency room, and how expensive that was, and how it didn't make sense to wait till your child is very, very sick rather than being able to get them care if they have a cold or something in preventative care. So I'm here for my mom. I'm here for my daughter, who is pregnant with her third child. She has a 2-year-old and 4-year-old little boy, and she's having a girl. Yay! So she's due in July, and when I think about she and her husband, a young couple working hard, trying to hold things together and make ends meet, and what it would have been like for her in Michigan prior to health reform. Prior to health reform in Michigan, only 3.5%, so less than 4% of the insurance companies that you would go to get insurance had maternity care as part of their basic policy, so less than 4%, which means you could buy it, but you paid extra. And we know that they want to go back to that, where being pregnant would essentially involve a pregnancy tax. And this reminds me of when Seema Verma, during her confirmation hearing in the Finance Committee, and was taking questions, and I asked her whether or not maternity coverage should be covered as part of basic health care, and she said she thought it should be optional. And the new Secretary of Health and Human Services said the same thing. He said, well, you can buy it if you need it. But the reality is, and this is something I heard all the time prior to the passage of the Affordable Care Act, young couple get started, and they are looking for insurance. They want to pay the least amount that they can. Their plan is not to have children right away. So they don't pay extra to get the maternity care coverage. And then statistics show us that half the time, whoops, they have a baby. So then what happens? Then mom is pregnant and she can't find insurance because she has a pre-existing condition. That's what was happening over and over and over again prior to the reforms that we made. So I'm grateful that my daughter is able to have basic maternity care as part of her coverage, and that her new baby girl will be able to get the care she needs as well. When we were discussing this back during the debates, and by the way, we did actually 100, counting the Help Committee and Finance Committee, 100 different hearings before passing the Affordable Care Act. We had a debate on maternity care, and as the lead in pushing for that in the Finance Committee to be included, I'll never forget Senator John Kyle from Arizona saying it shouldn't be in there because he didn't need maternity care. And I reminded him that I bet his mom did. And that's the difference for us. We understand how we're all connected and in this together, and that we all benefit from children having the opportunity to be born healthy and for women to have the health care that they need. We had a hearing yesterday through our Democratic Policy Committee that had 6 very, very powerful witnesses. And 2 of the women, Cindy Johnson from Indiana, who has a daughter with Down syndrome, which would be a pre-existing condition, spoke also about the care that she received through Medicaid to be able to care for her daughter. And Gina Walkington from Wisconsin talked about the fact that she went to a Planned Parenthood clinic when there was no other clinic available to her, and they detected and removed precancerous cells in her cervix, and she now is a mom of 3 beautiful children. That's what this is all about, and we are committed 1,000% to doing everything humanly possible to make sure that going forward, women's health care, preventative health care, maternity care is viewed as basic care under insurance in our country, and that we are moving forward to strengthen our health care system, lower the costs, not take away health care for Americans. Senator Gillibrand.
Thank you, Debbie. Thank you to all my colleagues here and our advocates. We're just a few days away from Mother's Day, and I'm sure so many of us are planning to be with our loved ones. But this bill is so personal to me because this was a year that 2 of my best friends survived cancer. And they had insurance, and so they could pay for the surgeries they both needed and the chemotherapy they both needed. They both had 2 young girls, and I gotta tell you, if they didn't have health care, if we were in the world of Trumpcare, they might not be covered. They might not have been able to afford this insurance, and they wouldn't be with us. So this is an issue that is very much personal to all of us. All of us have stories like that, and I would just urge anyone to imagine what it would be like to be a mother and to not have the insurance or the coverage that's needed to care for your child. Imagine anyone's child being born with special needs, with serious medical conditions, and not being able to pay for the life-saving care that your child needs. That is an untenable position that is too heartbreaking and frankly un-American, something that we shouldn't tolerate in society today. And I just want to close with the reality that we have 13 men writing this health care bill right now. I'd like to know what their personal experience is with women's health care. I'd like to know whether they realize that nearly every American woman will have to go to their gynecologist or doctor every year to get a cancer screening, to get a mammogram. I wonder if any one of them knows how much birth control costs, if they've ever actually gone to the pharmacy and purchased birth control. Do you actually know why preventive care is so important to America's women? So this is Washington, and so perhaps that shouldn't even shock us. But the fact that these 13 men have no experience in women's health care is shocking. The fact that 2.5 million women rely on Planned Parenthood to receive this basic care. Do they understand why that is the case? So I think care saves lives. The fact that we are arguing about a bill that's just a tax break for the wealthiest Americans among us is unsettling. My phone calls to my office have been constant. The phones have been ringing off the line. I hope every person who hears about this bill will speak out, will tell their own personal story, will go to Facebook, go to Twitter, go to Instagram, write letters to the editor, but whatever you do, you have to be heard. Tell your story, tell your senators why this is important to you, how it will affect your family, because if we don't speak out, we will be left with care that is not adequate, that will harm our families and hurt Americans. Thank you.
Well, I want to thank all of my colleagues and Natalie and Heidi for joining us here today. 1 week ago, House Republicans passed Trumpcare, which would hurt hardworking people across New Hampshire and America, and particularly women. It would lead to higher costs for less care. If you have a pre-existing condition, cancer, asthma, diabetes, you could once again be discriminated against with higher costs that make health coverage unaffordable. If you're between the ages of 50 and 65, Trumpcare would impose a new age tax. As you have heard, if you are a mother, giving birth could now be considered a pre-existing condition. And Trumpcare would end the requirement that insurance companies must cover essential health benefits, including maternity care. Trumpcare also ends Medicaid expansion, which would take care away from millions, including millions of people across our country who are getting treatment for substance misuse disorder now covered through Medicaid expansion, a critical coverage as we're trying to fight the heroin and opioid epidemic. Now, we're here today just a couple of days before Mother's Day because of the impact, as you've heard, of Trumpcare on women. Now, we know that when women are uninsured, they face avoidable adverse health outcomes. If you're an uninsured woman, you are less likely to use prescription contraceptives, and you may face barriers to paying for contraceptives, including the chance of an unintended pregnancy. If you're uninsured and pregnant, you're less likely, as Heidi mentioned, to receive prenatal care services. That increases the risk of maternal health issues. And if you're uninsured and get breast cancer, you're more likely to die from cancer or complications from it than women with insurance. This plan also changes Medicaid into a per capita caps or block grant system, which is really just code for very massive cuts, as you heard Mazie talk about, to Medicaid, over $800 billion. So this would force states to choose between slashing benefits or reducing eligibility for the Medicaid program. Natalie spoke so movingly about her situation. It is a situation that she and I actually share. I have a 28-year-old son, Ben. He is the oldest of our two children. And Ben, too, lives at home with home nursing services and other services paid for by Medicaid as our secondary insurance. We have primary insurance through our employers, but our secondary insurance that allows us to keep Ben at home is Medicaid. As a former governor, I know what it's like to look at a budget and try to figure out how, without federal Medicaid dollars at the level we have them now, to figure out whether you're going to cut eligibility or cut services for families like Natalie's, for people in nursing homes like our seniors, and for the children who depend on Medicaid services. And as you've heard, Trumpcare also continues to undermine women's health care by defunding Planned Parenthood. In New Hampshire, Planned Parenthood provides critical primary and preventive health services to thousands of New Hampshire's women, including preventive care, birth control, and cancer screenings. One of the great honors that those of us in public life have is talking with our constituents about what their lives are like, what their experiences are like. Heidi and Natalie shared their perspectives, their experiences today. What I know is that throughout the state of New Hampshire and throughout the United States of America, there are families and communities pulling together to support loved ones, friends, and neighbors who have health challenges, whether it's a lifetime health challenge like the one my son Ben has or Natalie's daughter Sophia has, or whether it's a year when you're battling cancer and need all the resources you can. I know how hard people work to take care of each other, to get their loved ones to care, to figure out the best treatment, to balance all the advice you're getting from different doctors. The last thing we should be doing is asking people in that situation to also worry about what that invoice from the hospital actually means and whether they've got to negotiate with their doctor's office or with their hospital to discount the care, whether they have to declare bankruptcy or sell a home or lose their home to afford critical medical care. We all know how to take care of each other. That's what we do as Americans. The notion that figuring out how to improve the Affordable Care Act is too hard and that we should just repeal it flies in the face of what we know about our capacity as Americans to come together and solve problems and move forward. Mothers know a lot about that too, and that's why, as we celebrate Mother's Day, I hope we'll all celebrate what it means to take care of each other, to look to our future, to take care of women, children, and men, to take care of seniors and people with disabilities. It's the least we can do as the greatest nation on earth. Thank you.
Well, thank you. I want to thank everybody, especially our mom, who told the story that no mom wants to have to tell. Thank you for having the courage to say that, because that's what this is bottom line all about. Thank you. Thought I'd take a couple questions. Yes.
Medicaid was a big thing today. The 13 Republicans who are talking about healthcare right now have floated the idea of increased tax credits or some sort of subsidization for people who might be kicked off Medicaid because of the reduction of the expansion. I would like your response to that.
You mean the 13 Secret Men's Society that's somewhere you actually know what they're talking about? That's fascinating. So we'll take it as that is an idea that they're floating, a tax credit. I will tell you that most people who are working and trying to take care of a fragile child don't earn enough to get a tax credit. That would be, in my mind, a benefit for the wealthiest of Americans who already have it. It probably, unlikely, would help most people today. Look, at most people end up in your situation. I don't want to speak for you. Expect to have a middle-class life. They're both working, never expect to have this happen to them. All of a sudden, they have a medically fragile child. One of them has to quit working. Their income automatically drops. Medicaid is there for them to support that, but I can tell you that their income probably, most likely, will not allow them to take a tax credit in order to get additional help. what we have consistently told Republicans, we are willing to work with them to fix some of the challenges that we have today still within our healthcare system. They have continued to say, no, we're going to do this behind closed doors under reconciliation. We do not need any Democrats to do that. Why? Because their goal is to repeal Obamacare, not to fix it. I have spent a great deal of time talking to insurance companies about why they're seeing some of the challenges. Yes, we want to fix that. You know what they tell me? The uncertainty that has been created by this political discussion and by a president who has refused to consistently say they will follow through on the payments that they have to make in order to keep the market stable. Beyond that, I can say many Democrats believe that one of the things that we can do in those counties that are now don't have it, beyond taking this discussion off the table so there's certainty, is to provide a public option, so that in the case where insurance companies aren't in those counties, they at least have one place that they can go. And by the way, that will drive competition that will help lower the costs as well.
Many Senate Democrats are working on Many Senate Democrats are working on ability to have some kind of public option, some kind of not-for-profit public option. Because you ask, in some of those states that have one or two providers, it's because the insurance companies aren't making enough money, and so they don't want to provide care because their incentive is profit. And so if you have a not-for-profit that's incentive is to care for people, you'll be able to cover them. So there's a lot of us working on a not-for-profit public option that somebody could buy into or be eligible for. There's also a bill to work on letting people at least buy into the DC exchange as another source of competition and provider.
And what she just talked about is for people today who are in places where there isn't any option beyond being public option, providing that would be the easiest, but maybe to allow people to buy into the DC exchange where they are across the country unable to purchase health care right now, just like their members of Congress do.
And I would just add that one of the things we were able to do in New Hampshire under the Affordable Care Act was put together a bipartisan Medicaid expansion program that actually moved Medicaid expansion onto our exchange. As a result of those added lives into the New Hampshire exchange, we saw more insurance competition. But I would reiterate, and the Trumpcare bill would allow states to repeal Medicaid expansion, therefore destabilizing the market even more. So I would reemphasize how important stability and predictability are to our insurance markets, and we stand ready to work with our Republican colleagues on improving and fixing our healthcare system. But as long as they're talking about just repealing it and giving tax breaks away in order to pay for the, to not pay for it, to just give tax breaks, it's not a discussion that we can really enter with them, but we stand ready to work with them to improve our healthcare system.
Can I just say one thing about Medicaid expansion? Notably, the states where there hasn't been expansion, that's where maternal death rates are the highest. Yeah. And some of them rival those in Africa, just saying, not acceptable.
All right, anybody else? Well, thank you all, and the most important thing, thank you to these babies who are awesome, and happy Mother's Day. Thank you. Thank you so much for sharing that.
Yes, thank you for letting me.
Absolutely, thank you. All right, thank you.